just explain, what NeuroKare is and how you got into it. Boom. Right.
Who wants to go
Pass
first?
the light off to you.
Yeah, who wants to go first?
I'm Stephanie.
Okay.
So depression is difficult to treat. And if you know anybody who's depressed and you say, they think up to 7% of adults in the U.S. suffer with depression. So depression is difficult to treat. And being healthcare providers ourselves, we see a lot of patients who suffer with chronic depression and other stuff like anxiety, PTSD. So traditionally you go in, you're prescribed medication, and a lot of these medications work by increasing some of our own body's natural hormones like serotonin, dopamine. And a lot of the problems, though, with some of these pill medications are it takes up to sometimes 12 weeks for some of these medicines to start elevating our natural hormones. And so we found ketamine is not a new drug. It's been used since the 70s, anesthetic. We use ketamine in surgery as CRNAs. We use it. It has got a lot of wonderful uses in military and civilian application as well. But what we're finding is ketamine has some amazing application for patients who have chronic depression, patients who have a diagnosis of PTSD and anxiety. And it just sort of works in a different way, really rapid acting, and it works by certain body receptors, like the NMDA receptor. And what it does, it sort of blocks that receptor. And a lot of studies are going on with ketamine. And like a lot of things, we don't know exactly how it works. I mean, we know how some things work, like volatile anesthetics. Like when you go to sleep, you have general anesthesia, we turn on the gas, and so you go to sleep. But we still don't really understand how that works in the body. But we know it works because our patients go to sleep, and it's a safe way to administer anesthesia, and then they wake up at the end when we turn the gas off. Well, ketamine is sort of a newer application of it is for the treatment of chronic depression, PTSD, and anxiety. And so what they're finding, it's a really rapid response. So it's not like this several weeks for waiting to get certain things in balance and levels up. It's pretty instant. And so some of the uses that we do with NeuroKare, which is our ketamine infusion clinic, is we do ketamine infusions. And so we're seeing some really amazing results and pretty quick, with usually is like a first infusion for our patients with chronic depression and anxiety at NeuroKare. So there's a need for it, and there's a lot of people that suffer with depression. And so it's encouraging whenever you can do these transfusions of ketamine and see patients and you're getting these amazing reports like the next day or 2 days later, talking what an amazing transformation of people in their personal life, and people who are not comfortable going to like the movies before are now going to the movies with their family, and they're traveling and calling their friends. And so it's pretty amazing to see some of the results with ketamine infusion. And so I think as providers, we saw a need for this in our communities and thought this would be a great way to sort of help out and sort of jump in on a problem that is sort of understaffed. And there's not a lot of healthcare. Mental health is highly overwhelmed in most places. And I think in the South, demographically, we have our fair share of people who suffer with depression. But that's what